Hi, my name is Greg Feld, Director of Public Health in Sheffield. This is a COVID situation report dated 31st of March 2022. Firstly, Epi. It's fair to say that increases everywhere. Increase in prevalence of COVID everywhere. Sort of a gentle fall off of BA1 or Omicron 1 and a gentle rise of BA2, Omicron 2. The gentle being the operative word, nothing like the exponential growth that we'd seen with the first wave of Omicron, but there definitely is a rise. Look at the ONS infection survey. That's happening up and down the country. Sheffield is clearly no exception to that. Happening in all age groups. Some are suggesting that, looking at the data, that rise has peaked. Maybe a bit too early, but probably soon. I think it'll peak and then will fall off. Is my guess. It is a guess. Appears to be happening in more affluent groups. COVID or Omicron has been through less affluent groups already, first time round, and therefore they have the people in some groups have residual immunity from the first wave of Omicron. So it appears to be having a greater impact in more affluent towns and more affluent cities, and probably within that more affluent parts of the city. There are no massive red flags. So the four red flags that I've always been worried about are a rise in people in intensive care due to COVID infection as opposed to found incidentally to have COVID, a rise in hospitalizations due to COVID, and neither of those is anything like in play. There is a gentle rise in hospitalizations, but not a huge rise. Not seeing any rise in mortality. The vaccine continues to do the job expected of it and does so very well. And actually we've got below seasonal mortality for this time. And the new variant, who knows what will happen there. It's never been a good time to end testing, and I'll come back onto that in a moment. But I would characterise what we're seeing now as damaging but not hugely high risk, and we'll see the BA2 wave fall off in the next couple of weeks. So on testing, many of you will have read the statement by Secretary of State in Parliament yesterday and subsequent publication on the Department of Health website, and there'll clearly be a lot more communication on that over the days to come. In line with that announcement, PCR testing centres will be closing on or before the 30th of March, i.e. today, and PCR tests will no longer be available for the general public who have symptoms. We've seen some test sites close already, so obviously Upperthorpe, Halfway and Middlewood, and those sites will return to former uses pending any works that we need doing. So what should you do if you have COVID symptoms? Same thing as I've always said, the best things that you can do is not spread your bugs, so isolate, stay at home, keep your distance, wash your hands, open the windows, get ventilation in, wearing masks has always worked, sanitising surfaces, all of those things that continue to and will continue to make a difference for forever. And if you don't believe that, look at what's happening with rates of other respiratory viruses have gone right down. So those things definitely have made a difference. I think it's worth being particularly mindful if you live with somebody who works in the NHS and social care system, because clearly they'll be working with people who are more medically vulnerable. It's worth being particularly mindful if you live with someone who is clinically extremely vulnerable, i.e. those who are have compromised immune systems. What should you do if a family member isn't getting better? As in a time-honoured way, call 119. Probably worth, if you do have a compromised immune system, call your GP. I have a lower threshold for calling your GP, but you use 119, use primary care. If you have symptoms, be careful about going to your GP, and I'd encourage you to call first, and clinical triage will happen. Lateral flow device testing for the general public isn't going away, but will still be available, but you'll have to pay for it from the 31st of March. Just because testing is changing doesn't change any of the other interventions to reduce risk. So masks, windows, ventilation, distance and isolation still continue to make a difference, and I'd encourage you to think about those things as well. So on vaccinations, COVID remains more serious and significant in older people and those with a weakened immune system. protection from the vaccine may be lower and may decline more quickly. Immunity may decline more quickly in some groups. So for that reason, people aged over 75, those in care homes, and those people 12 or more, to age 12 or more with a weakened immune system, are being offered the spring booster, and that's happening now. So it's being offered as a precaution, and walk-in clinics are available up and down the city. So please visit the website for more information. As we move back to some semblance of normality, it's never too late to get your first and second dose of the COVID vaccine. The group I worry most about by some considerable distance are those that haven't yet been infected in any way, shape or form through the course of the pandemic and who are not vaccinated. If you disbelieve that this is a serious infection that can cause deaths, I'll encourage you to look at what's happening in Hong Kong and China, where there's a much lower rate of vaccination and the use of a different vaccine, a less effective vaccine than we've used in this country. The death rate is huge in those countries. That's a travesty rolling out on a very, very real scale. So for those of you that don't believe that the vaccine works, look at what's happening in China. So if you haven't yet had your vaccine, I can only encourage you to do so. You need to choose to want to do so, but I can only encourage you to do so. So COVID vaccination and other health information is available on the Healthy Sheffield social media pages, and we're moving all of our public health information back onto the Healthy Sheffield pages, formerly known as Rate Healthy Chef. More information and links are available at the end of the video, and you can subscribe to the newsletter. So lastly, thank you to everyone who continues to help those who are vulnerable and the elderly who feel that they're too nervous to go out, and thank you to those who help single parent families, for example, get much needed supplies when they choose to self-isolate after testing positive. Your support to those people has mattered and continues to matter. And finally, thanks to everyone who gave feedback on these videos. It's kind of humbling to think that so many of you have found them quite useful. And thanks for all of your suggestions as to other things that we might need to cover. I shall give some thought to that, how we do that over the next couple of weeks.